I want to talk about something very important, erections.
Yes.
Gonna be serious for a minute. Erectile dysfunction is a big problem for a lot of men out there, but could your blood type be to blame? According to a recent study, researchers in Turkey discovered that guys, interestingly, with type A or type B blood were about 4 times more likely to suffer from ED than men who had type O blood. 4 times more.
That's significant.
That's shocking. As a woman, how can we support our men? Because I know it has to be something difficult to be able to talk about, that you are suffering from something like that. How can we be supportive in that and kind of open the door to
well,
just...
it's simple. I mean, you know, the status of your erections is directly linked to your overall health. So that if you have that nice morning riser, that means you're in good health. So, so if you see that, Rosie, you just say, good boy, you're doing good.
And I do want to say one thing, and this is important for any man out there. You know, blood flow, that's what creates an erection. Poor blood flow is what creates a physiologic problem in terms of erectile dysfunction. But a lot of erectile dysfunction is psychological, and that is a completely different mechanism. But the theory may be that for whatever reason, men with A or B blood type, maybe it's a little bit, quote unquote, stickier. If the blood type is a little stickier, well, it doesn't flow as well. And that's one of the theories, but more studies need to be done on this.
What about age? Does it affect a certain age?
Well,
more common?
The older you are, certainly.
The more erectile, but it's not necessarily age-related. It's because when you're aging, you have more medical problems and you take medications that lead to erectile dysfunction. It's not age in particular. But the AB blood thing is interesting too, because A and B blood types do have more heart disease and higher cholesterol. And so, FYI, little inside scoop, if you are having erectile dysfunction, that's usually a 3-year heads up that you may have some heart attack problems coming.
Supporting your man, part of it is saying, look,
imagine, like, ego-wise, it like must hurt a man's ego to be able to even not be embarrassed and to be able to say, look, this is going on, or to want to even go to the doctor.
Well, and there's also a big difference between the occasional difficulty.
That can be more emotional.
I'm just laughing at my wife. Go take your pill. Go take your pill, it's all good.
Drew has lost so many of his pills because they blend in with our blue cards on stage.
Where is it? Oh my God. I think somebody up here is taking my pills.
But obviously, if you're worried as a man or worried as a woman about your man, having your, talking to your doctor about what may be the cause and finding the appropriate treatment is so very important. We'll be right back.